Welcome back to AM Northwest. You know, a smile conveys confidence and joy. But it's hard to smile when your teeth aren't looking their best. Here to share how implant dentures could be just what you need to start the new year off right, we welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Good to see you again.
Thank you so much, Helen.
And your smile is huge because I know your son is just bringing so much joy to your life.
Yes.
How's Roan doing?
Little Roan is 4 months. He is amazing. He's pretty much sleeping through the night.
Oh, nice.
There he is up in the Wallowa Mountains the other week in his Teletubby snowsuit. He is snug as a bug in there, and we can go snow hiking with him, and he just loves it.
That's so great.
He's just
precious.
Look
at you playing in the snow.
Yeah.
Did you go sledding with him? Or
we went sledding. My wife let me take him down 2 small runs, and
she's smart.
I think he liked it.
Well, you did for sure. So you know.
So he's doing great. I also took the dog sledding as well, and he stayed on the sled the whole time.
Really? That's fun.
14-year-old boxer.
Wow.
He cooperated. It was amazing. He had a good time, too.
That's fun.
Yeah.
Well, let's talk about why you're here.
Okay, let's talk about teeth.
Talk about teeth.
Okay.
Implant dentures, and you had a recent client, a new client, Victoria.
Yes.
Tell me about her.
So Victoria came to my office. She was very unhealthy, a lot of health issues, heart issues, and what it turned out is she also had about a dozen infections in her mouth, too.
Oh, wow.
Her mouth hurt. She couldn't go out and smile. And if we pull those lips back a little bit more, she's missing all her back teeth. And those teeth that are in there right now, they are infected. So about a dozen infections. So all these infections are draining into her sinuses, draining down into her throat, the rest of her body.
She must not have been feeling very well.
She felt crummy.
Yeah.
She felt terrible.
Right.
She wonders why there's no energy, why it's hard to get out of bed.
Mm-hmm.
And so she came to our office, and we figured out what was going on, and that the teeth were not able to be saved. They were goners. And so we decided to take them out, get the infections out. We put 4 implants in the top, 4 implants in the bottom. We did all that in one day, and then we gave her her new implant dentures as well.
Wow.
So one day we got all those infections that she's been fighting for the last several years
Right.
out of her mouth. And after a couple weeks, she feels like a different person.
Right.
Because her body isn't fighting all the infection anymore.
She looks fantastic.
Yeah, and that picture's at the 4-month mark after we completed everything. We do pretty much all the work in one day, but we complete everything at the 4-month mark once the implants are solid with the bone.
Well, and I'm sure, too, every individual is a little different in healing time, right?
It is, and that's one thing that, you know, I found in the last 12 years of doing this is, yeah, it takes about 4 months, but some people can be a little bit less, some people can be a little bit more.
Mm-hmm.
Just depends on the bone, the environment, how their health is as well.
Okay, how does it work from start to finish? And for instance, are you able to eat regular food while you're in the middle of this process?
Okay, so, you know, I like to be frank with my patients.
Yeah.
I like to be honest and forthright. So the first couple weeks, it's going to be sore in there. It may hurt a little bit for the first few days, too. You may be bruised, you may be a little bit swollen, but all that goes down after about 2 weeks. And so after that, things are feeling more comfortable, implants are healing, gums are feeling good, and you can actually start eating soft foods, but you're going to be eating very soft foods for the first month or two, and then as you get more accommodated and accustomed to the new teeth in your mouth, you're going to get to more firm foods. And then at the 4-month mark, when we connect all the implants, finish everything,
Right.
you're going to be eating pretty much what you want. I always caution my patients, whether they're getting implants or even like crowns or veneers, stay away from really sticky and hard foods. Don't chew peanut brittle. Stay away from ice.
Right.
Don't bite jerky with your front teeth.
Right.
Treat them like...
Don't use them as tools.
Teeth are not tools.
Right.
So don't bite fishing line or, you know, sewing needles. You know,
Right.
all these little things that I see, you know, what can happen.
Right.
So be gentle with them.
Be gentle.
You know, your first set of teeth failed, and that's the strongest thing you'll ever have.
Right.
The new set, while strong, I want to give my patients the best, could do that too. So this is your new lease on life. Take it easy on it.
You mentioned, too, that she was afraid she wouldn't be around for her grandkids.
Yeah. So she didn't know, Victoria didn't know how long she would live, you know,
Right.
you know,
'Cause she
before
just
we
was
did all
feeling
this
so
work.
bad, yeah.
Yeah, feeling so bad. We got all this done. And at that 4-month mark, she is a new person. And it's amazing to see that glow, that zest, that light come
Right.
back, because so many of my patients, they come in that situation, and after 4 months, they're different people. And this isn't something they teach in dental school. This isn't something they teach in our education classes that we go
Right.
to after dental school. This is something I found first and foremost. And it has just blown me away that it happens time and again.
Yeah.
And that's what makes me feel good about what I do.
Yeah. Well, she looks great.
Thank you.
Good job. And kiss Roan for me, would
I will.
you please? Appreciate that. Okay, Sleep Dentistry Defined. Give them a call, 503-646-2273.